Well, welcome to today's Youth-Centered Care webinar. I'm really glad you're here. Our focus today is on how we as clinicians and healthcare staff can train our colleagues or healthcare teams when our resources and time are limited, something I know we're all very familiar with. Next slide, please. My name is Kristen Teifel, and I direct the State Adolescent Health Resource Center at the University of Minnesota, and I manage this youth-centered care learning community that the webinar today is part of. This is all part of a larger national resource center for adolescent and young adult health. Today, we're going to look at one important component of the youth-centered care, and that's ensuring that we as clinicians and staff who care for youth have the skills, knowledge, practices that we need to truly meet young people where they are and help them meet their health needs. Or, as my 17-year-old daughter, Maddie, says, just give me the space where I'll open up and I'll actually talk to you about the things that get in my way. So we're going to learn about a new training resource called Sparks that's brought to us by our, by our webinar co-sponsors from the Adolescent Health Initiative at the University of Minnesota. Next slide, please. So welcome to my colleagues, Lauren Rinaldi and Ellen Wagner from the Adolescent Health Initiative. They're going to tell us all about Sparks. Lauren directs the Adolescent Health Initiative where she's been since 2013. She comes to us with a master's in public health from the University of Michigan and a Bachelor of Arts in Psychology and Education from Washington University in St. Louis. She brings also along a rich experience working with federally qualified health centers and community-based organizations in both Illinois and Michigan, and her previous work as a vice president of the Michigan chapter of the Society for Adolescent Health and Medicine, which, if you're not familiar with, definitely go search it out. Ellen is Adolescent Health Initiative's project director, where she's been since 2016, and she comes to us with a master's in both public health from Columbia University's Mailman School of Public Health and basic medical sciences from the New York Medical College, in addition to undergraduate work in politics from the University of California in Santa Cruz. Her rich experience comes from work in New York City, leading patient-centered outcome improvement projects in a variety of settings, including a large health and human services agency, public hospitals, and academic medical centers. So thanks, Ellen and Lauren, for being here. I turn it over to you.
All right, hi everybody, this is Lauren Rinaldi. Hi, this is Ellen Wagner. And we're really excited for you to join us today on our training about how to facilitate Sparks. So the Adolescent Health Initiative is based out of the University of Michigan, but we work with a national audience of providers and healthcare professionals to provide training, technical assistance, coaching, and improve adolescent-centered care and adolescent health outcomes. And we're working in about over 40 states right now. So here's what you can expect from this training today. We're going to share what a Spark is, and then we're going to demonstrate one for you. After that, we're going to briefly review the Spark model and dive into how you can deliver a Spark at your organization. So let's go ahead and get started. So AHI developed Sparks to meet the needs of health centers and youth-serving organizations that have really limited time for staff training, but who are interested in improving the youth-friendliness of their organization. AHI currently has a menu of 8 Spark trainings, and they're all available for you to use and download directly from our site. Each Spark comes in a version designed for clinical and a non-clinical audience so that they can be facilitated in your own health center or organization, or shared with community partners, or used for partnership building, professional development opportunities. Today we're going to show you an example of a clinical Spark. So what exactly is a Spark? Sparks are mini trainings that can be delivered in about 15 to 30 minutes, and are just meant to spark reflection, conversation, and ultimately behavior change. So they include ready-made PowerPoint presentation, a script, and accompanying materials so that they're ready to be used and presented with very little preparation on your part. Organization for the rest of the organization. And in time. They're thinking about what we call sparklers, short activities. Sparklers use you can see how it works. So this is a spark on being youth-friendly. So for this demonstration, Ellen is going to be in the role of the facilitator, and we're going to ask that everyone participating today, is going to kind of pretend that we're all together at a staff meeting. And I see that some people are saying that the audio is cutting out. So we are going to, I'm hoping that everyone can hear me a little bit better now. Okay, apologize for that. Okay, so I'm going to back up for just a second. So we're going to do a Spark demonstration for you now. So Ellen's going to be in the role of the facilitator, and we're all going to imagine that we are at a clinic or a staff meeting together. So please use the chat feature to participate in the brief activities as if you were actually a participant in this training. So as a final note, the Spark consists of a script, which Ellen is going to mostly follow, so you get to feel for it. And she'll also provide you with some prompts and suggestions about how you might facilitate this on your own. So now I'm going to turn it over to Ellen.
Great, thank you, Lauren. So hello, everybody, and great to see our whole team here at this meeting. As a reminder, I'm Ellen, your grants manager. That was such a lively discussion that we just had about which types of paper clips we should buy for our office next. For the next item on our agenda, we're going to do a 15 to 30-minute mini training, also called a Spark, to look at ways we can best meet the needs of the youth we serve. And this Spark is on being youth-friendly. To help us think back to our own experiences as youth, we're going to do a quick activity. Okay, so normally if you were doing this Spark in person, you would ask participants to turn to the people around them and fill in the squares of a handout that had these questions that you see on the screen. Talking to as many of their coworkers as they can over the next few minutes. For the purpose of this webinar, we're going to take a moment to chat in some of the responses to these questions. So, what is your response for the first one about what was important to you when you were a teen? So use the chat feature and chat in what was important to you when you were a teen. Friends, music, getting into college is a big one, fitting in, sports, peers, college, being social, yep, having close friends, sports, grades, sleep, I love that one, yeah. Music, friends, family vacations, parties, yep. I'm struck by this question that I think with the exception of getting into college, because luckily that's behind me now, that most of these things still feel really important to me now, which is just kind of an interesting observation. Okay, let's do another one. What is hard about working with teens? So chat in your responses to what is hard about working with teens. Attitude, language, moody, their reliability, yeah, lack of interest. If they're being honest with you, creating rapport, social media, I see lots of great, more than I can name at once, scrolling past, great generation insecurity, yep, relating to teens, emotions, handling their parents, that's a really interesting one. It's not even the teen themselves, it's their parents. Drama. Patty, I bet you are pretty cool. Give yourself some credit. Brain development, all really great responses. Okay, one more. What is the best thing about working with teens? Chat in. Brutal honesty, energy. Yep, their creativity, perspectives, humor, return on emotional investment. I love that. Open-mindedness, drive. All of these are great. opportunity, energy. There is never a dull moment. Their future, there's so much possibility, right? They're passionate. Okay, let's do one more. What makes working with teens unique from working with young children and adults? So chat in some thoughts on that one. This one's a little trickier. They're at a very critical development period. They're just beginning independence. They think differently than young children and adults. That's a really important point. Their development and their experiences, they don't know what they don't know, and they think they're invincible, yes. A mix of adult-like and childlike, yep. All of those things are great responses. Okay, so the purpose of this activity was to help us think back to our own experiences as young people and to remind ourselves that it might take some special effort for us to meet their needs as they engage with all of the staff at our organization. So let's hear from teens directly in this 3-minute video that I'm going to play about how they want to be involved in their healthcare. The teens in this video are from the Adolescent Health Initiative's Teen Advisory Council. And as you watch, keep this question in mind. What might happen when youth don't feel comfortable accessing services, and what might happen when they do feel comfortable? Oops, sorry.
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait, but hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plants are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I'd like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Y servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ+ youth, such as a rainbow sticker on the door. Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the exam room.
Of course we expect it to be clean and professional, so what matters most is our interaction with your doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having a confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so is doing check-ins throughout our appointment to make sure we're on the same page.
Remember, not all situations are the same, and not all teens are the same. When in doubt, ask us.
So thinking about the video and the perspectives of youth, What might happen when they don't feel comfortable with their healthcare experience? And what might happen when they do feel comfortable? They don't return, withdraw from care, they skip appointments, they're going to walk out. They're going to get there and they're just going to leave. They're going to be hesitant. Yep, they're not going to share with their friends that they had a positive experience. They're not going to tell you what really happened. They're not going to share important information. They're going to shut down, not be honest. Great. And what can happen when teens do feel comfortable with accessing their services? Good preventative health, they're going to return. They are going to be honest if they do feel good about it. They're going to tell their friends, kind of the opposite of what happens when they don't feel comfortable. They're going to be informed. They're going to share good information. They're going to tell their friends. Yep, great. So while teens are in this transitional stage of life, we know from research that teen brains are at a critical point of development. The part of the brain that controls executive functioning, which includes judgment and cause and effect, is not fully developed until the mid-20s. When teens make decisions that seem questionable, it's helpful to remember that this can be developmentally appropriate, even if it's frustrating for us to see. A great example of how teen brain development is unique in this age has to do with risk-taking. People of all ages take risks, but it's at its peak during adolescence and can be both good and bad. There are emotional risks, social risks, and physical risks that all help adolescents to build their identity. But some risks can be unsafe. The CDC reports that 3 out of 4 adolescent deaths, diseases, and disabilities are a direct result of risky behaviors. This is disproportionately high compared to other age groups. This also means that there are opportunities for prevention, and we could change the outcome for teens through doing good screening and counseling. So, if their behaviors are developmentally appropriate, as challenging as they may be, what can we as adults do to help them along the way, and we as healthcare professionals do to truly be patient-centered? So one of our main goals with becoming more youth-friendly is to look at how we interact with young people and help them feel welcome. There are lots of ways that health centers can be welcoming to young people, and we have 8 of these behaviors listed on this slide. Normally, when you're leading the Spark in person, this information is going to be on a handout, and then there will be a few following slides that are going to represent some of the scenarios that I'm about to now read aloud. So just know that this is a small change, again, for the purpose of leading this through this virtual setting that will look a little different when you actually do this with your team. So for the next few minutes, we're going to review a few scenarios and then chat in which youth-friendly behavior you see on the screen relates to it. There's no right or wrong answers, and some of these you're going to find multiple answers. First scenario. Studies have shown that providers often don't counsel their adolescent patients with chronic illness on reproductive and sexual health, even though adolescents with chronic illness participate in sexual activity at the same rate as their peers without chronic illnesses. So which youth-friendly behavior does this relate to? Keep in mind, this is obviously an example of what you don't want to do. So chat in your answer. Which one does this relate to? Fair and equitable treatment. Yep, that's number 2. Right. Okay, let's try another scenario. My mom talks to her, and she talks to my mom. I'm just there. I'm just there to get poked. This is a quote from Luis at age 16, and is another example of a not-so-adolescent-friendly interaction. Which one does this one relate to? I see Sharon has said number 3. Yep, listens to and objectively considers what adolescent patients have to say. Agree. I see a resounding consensus 3. Yep, also confidentiality, and 1 could apply to this. Number 4 as well, accommodates needs. Great. Okay, let's try another one. The following story is from Ray at age 23. When I explained to the staff that I didn't have insurance, she was like, oh, there's this program and there's this resource and you can get help here, or you can go this route. And I was just like, whoa, no one ever told me that before. Otherwise, I felt doomed, and she gave me hope. I've gone to other really nice places, and same thing, they were just positive about it, like, that's no big deal, we can work with that, and there's options. Whenever I was given options and I didn't feel hopeless, it was a good experience. So which youth-friendly behavior is this an example of? I see lots of people already saying 6, patiently helps adolescents navigate referrals and any other systems that may be challenging. 5 also can apply, and 4 as well. Positive body language and accommodating needs. Great. All right, one more. You have to explain that nothing bad is going to happen if I'm honest. What do you think Ciara is referring to when they say nothing bad is going to happen? Which youth-friendly behavior does this relate to? Yep, accurately describes and applies confidentiality and consent laws with all adolescent patients. 8, uses sensitivity and maintains neutral language and body language and is judgment-free. Agreed. 5 as well, uses positive body language. 4, listens to and considers what adolescent patients have to say. 2, 3, I think we're listing all of them here, which is great, right? All of these youth-friendly behaviors can really be applied to any scenario. Great. And that's the end of today's Spark. Thank you so much for participating, team. To get this conversation going over the next month, I'll share sparklers or case scenarios that relate to being youth-friendly. I'll post the sparklers around the office and places that everybody can easily see. And when you see a sparkler, take a moment to read the scenario and think through the questions listed on the page. Thanks so much for everybody's participation.
All right, thanks Ellen and virtual team. So now that we've modeled a Spark for you, we're going to spend a few minutes diving into the actual Spark model. So all Sparks follow the same outline. The hook is what emotionally draws someone into the topic. Key concepts introduce the content. The application and sparklers give participants ideas on how to put what they've learned into practice and into action. So for the Spark we just did, the hook was the teen years activity. The video introduced key concepts, and discussing the behaviors and how they apply to practice was the application portion. So now that you know what Sparks are, let's talk about how to effectively deliver one in your clinic or your organization. So the good thing is you do not need to be a seasoned public speaker or content expert to deliver a Spark. What you need to be is a facilitator. So using the chat feature, can anyone share what qualities you think make for an effective facilitator? Practice, yep, kind of knowing your stuff. What else? What makes for an effective facilitator? Listening, being engaging, feeling comfortable with the topic, asking questions. Yep, definitely being organized, I think. Enthusiasm. I think enthusiasm goes a long way, definitely. Any other thoughts here? What makes for a good facilitator? Being an expert, open to different opinions. Great. Thank you all for sharing. Yeah, I agree with expertise, and I also think that for part of what makes this model successful is because it's developed in a ready-to-use way. You don't have to actually be a content expert here. You just have to know how to engage people. We're going to talk about that a little bit more. But I agree that things like adapting to the group's need, being a clear communicator, being prepared, watching the schedule, making sure that if you say this is going to be 15 minutes, that it's 15 minutes and not 45 minutes. Feeling like you care about the participants, that you're encouraging people, and then also I think sometimes a sense of humor can kind of go a long way. So those are all great examples. Thank you. So as you can see on this slide, to facilitate means to make easier, meaning we create a safe and supportive space for people to work together and learn by providing a structure for learning. So a facilitator is a person who effectively and efficiently guides without directing, brings about change without disruption, and assists people and groups in constructing their own learning. So Sparks are designed to be delivered by a facilitator rather than a presenter. They're supposed to be conversational and spark dialogue rather than being focused on transferring knowledge from the presenter to the audience. Let's keep this in mind as we continue. We're going to spend a minute thinking about 5 adult learning principles. So as adult learners, we need to know what and why we need to know. We like to have a deep need for being, or we have a deep need to be self-directing. We have a deep reservoir of experience that is a rich resource for learning both for themselves and for others. And adult learners become motivated to learn something when they experience a need to learn it in order to cope with real-life needs, interests, or problems. And adult learners attach more meaning to learnings they gain from experience than those they acquire passively. They prefer problem solving over subject-centered learning. So using the chat feature, which of these principles resonate with you as a learner? You can type in the number or numbers that you feel most connected to. 2 and 4 and 5. We're motivated by things that feel meaningful. Yep, we like to be kind of active learners, I think. 3, that we have our own experiences that are helpful and that we sometimes like to share. Great, thank you. Yeah, I definitely see myself in a number of these. So when you're facilitating a Spark, think about which principles might also resonate with your staff and how you can use these principles to effectively provide professional development opportunities. So some examples might include providing background or rationale for the topic, including interactive conversation prompts, or have opportunities for participants to share their own experiences and expertise. So when you download a Spark from AHI's website, this is what you'll receive. You will get the PowerPoint slides like the ones that Ellen shared with you. You'll get the facilitator script like what she was reading from. You'll get all the participant handouts, and you'll also get the Sparklers, which are follow-up activities that can be shared throughout the month. So this is an example of the script. So at the top, you'll find the supplies needed for the Spark. So often this includes like a projector, a laptop, speakers, copies of the handouts that go along with the Spark. So just be sure to prepare everything before the meeting. We always suggest, testing the audio if you're going to be playing a video, things like that. You'll see that the script clearly notifies you when to switch slides with this computer icon on the slide title. And Spark scripts are already written in a conversational tone. Occasionally, though, you'll see some blue text providing the facilitator with instructions or prompting you to include personal stories if you'd like. The goal of the script is to make it as easy to use as possible, requiring very little preparation time. So we heard from some folks at the Alabama Campaign to Prevent Teen Pregnancy a couple weeks ago who said, I found your Sparks online last night and I used them in my staff meeting this morning. And that was great because that's exactly how easy they are. That's how they're meant to be. We don't want you to feel like you have to put in a lot of time and energy to preparing information. And this is an example of one of the Sparkler case scenarios and some information. So things like this would be something you could post in break rooms, in sort of common areas, quotes from adolescents and some kind of tips and things for people to think about to kind of keep the conversation going. So now that you know the background for Sparks and you've seen one in action, what's next? So first, we encourage you to take a look at the topics available on AHI's website to see what might be a good fit in your setting. So we've hyperlinked them here. You will get a copy of these slides. So this will take you directly to the Spark menu on our website. So in addition to the Being Youth-Friendly Spark that you participated in today, we have, I think, a total of 8 right now, including things on adolescent brain development, being an askable adult, strengths-based approaches to adolescent sexual health, non-judgmental communication bias, and other topics. So the next thing is think about your setting. So Sparks can be facilitated in the health center with the entire practice team. So for us, that really means everyone from the front desk staff, medical assistants, social workers, physicians, even security guards, anyone who interacts with patients. Sparks can also be used for professional development opportunities with community partners. So you could share the format with them or offer to facilitate a Spark in their setting. And we've helped organizations host Spark train the trainer sessions for partners in their community. So feel free to connect with AHI after this webinar if you have questions or ideas about how Sparks could work in your setting. And then finally, schedule one and let us know how it goes. We're always excited to hear from people across the country about their experience, and especially if they have ideas for new Spark topics, because we're always kind of creating more, and we'd love to hear from you about what you feel like you could use. So I also want to take a quick moment to tell you about other resources that AHI has developed all towards the goal of improving adolescent-centered care. We have a number of tools available for health centers to assess the adolescent friendliness of their site. So these range from simple checklists to a youth-led assessment process to more in-depth quality improvement initiatives to help health centers become certified adolescent-centered environments. Starter guides are mini toolkits that offer concrete, actionable steps to improve the adolescent care. We have 9 guides available, and they include topics such as improving well-child visit rates, increasing chlamydia screening rates or HPV vaccination, establishing or enhancing collaborations between primary care providers and school-based health centers, and a number of other topics. And the starter guides often include things like sample workflows, sample patient letters, links to additional resources, and they're typically about 2 to 4 pages long, which is meant to sort of just have a lot of like easily digestible information to help health centers or organizations get a project off the ground or enhance projects that are already ongoing. So for health centers, we've also created a number of resources that help providers and staff understand the principles of adolescent-centered care, as well as some posters and things that provide visual cues to patients that adolescents are a welcome and valued population. Co-developed an advisory council, so they're all youth-driven, youth-informed, and much better than anything we could ever create just on our own. In addition to the video you saw in the Spark, AHI has created a number of other youth-driven videos for providers, parents, and teens, including topics such as teen self-advocacy, being your own healthcare advocate, voices of transgender adolescents in healthcare, and a video for parents on transition called Take the First Step Out of the Exam Room. Again, most of these resources are available, so I hope you'll take advantage of them, check it out, and let us know. I see there's a question. The case scenarios for alternative care locations like rural communities with initiating nurses or clinics and community aides or tribal health. Yeah, that's a great question. So the Spark is, well, it's meant to sort of be a template. So if you want to adapt a case scenario for something that feels more appropriate in your setting, absolutely feel free. We want this to be as user-friendly for you as possible. So we've put together the case scenarios based on some common things that we've heard from health centers around the country, but absolutely feel free to make it your own. All right. So lastly, I wanted to let everyone know that registration is now open for the 2018 Conference on Adolescent Health. I recognize some names from this webinar, and I know we've seen some of you there in past years. But this is an annual event that draws physicians, nurses, social workers, researchers, students, and public health professionals from across the country, and actually an international audience. One of my favorite things about this event is that half of the sessions at the conference are co-facilitated by youth collaborators, which provides real-time perspectives from youth on how providers and health professionals can improve adolescent-centered practices. So registration is open now, and early bird rates are available through March 9th. It's a really fun event, and we hope that you can join us in April. We've got some special things planned for our 5th annual conference. So thank you so much for participating in today's training on how to facilitate a Spark. We're really excited to hear from you. If you're using these tools and resources, how it goes. Please feel free to reach out to us for additional support as you start thinking through how you might facilitate Sparks in your setting. And we're going to open it up now to see if anyone has any remaining questions for us. Do you know of any tools for use in elementary-based health centers? So we have a couple of things on our site that you might want to take a look at that might be helpful. I would also recommend checking out the National School-Based Health Alliance because they work with school-based health centers in elementary, middle, and high schools. And I know they have a lot of resources on their site, which I believe is sbh4all.org. Other questions? Okay, well, if not, we're going to hand it back over to Kristen. She's going to send out all the slides and our contact information. So you're welcome to get in touch with us directly. We'd love to talk to you about any of the needs that you have in your health center or in your community.
Thank you, Ellen and Lauren. As always, what an excellent opportunity to learn about your resources. And if you haven't gotten excited by this, definitely go look at their website and download some of these resources and give them a call and attend their conference, which is fantastic. It's just great, cool stuff. And share this out widely. Share this with people you know, because I think the more we can spread this, the better we can do with and for our young people and help support them to flourish and thrive and be healthy. So thank you.